Much like malaria, Zika is commonly transmitted through mosquitoes. It's been around for a while, but in 2016 there was a sharp increase in cases. Since then, the number of cases has declined. Christian Anderson, an infectious disease researcher at the Scripps Research Institute, said he wanted to find out whether there were some outbreaks that were going undetected.
So we had this big question that, okay, we don't see Zika cases reported, but is the epidemic really over?
Anderson created a methodology for detecting these cases. It involved two things: tracking where infected travelers went, and then looking at their biological samples, like blood, to see genetically where and when their virus originated.
We instead looked at what do travelers get. So travelers that come back into this country, for example, have been traveling around to Zika endemic countries. Do any of these actually get infections?
By coupling travelers' geographic data with biological data, Anderson said it created a type of map of where the disease may have originally started and where it could spread. In 2017, this method helped these researchers discover an undetected outbreak in Cuba. Now, Anderson says he thinks this research could help public health authorities track other infectious diseases, like dengue fever.
Right now, there's a lot of dengue activity across the world. And you can imagine doing things like this to actually potentially detect dengue cases in countries or regions where you didn't realize that there were dengue cases, for example.
Anderson says the method would need to be coupled with existing public health reporting. And he says it probably wouldn't work in rural areas where there are few travelers. For KPBS News, I'm Shalina Chatlani.